Hello everyone, welcome back to MGK Educare. So in this class, we will discuss NCLEX-RN MCQ Series 1 MCQs along with the rationale. So let's see the first question. A nurse is caring for a client with heart failure. Which of the following finding indicates fluid overload? A. Bradycardia, B. Weight loss, C. Crackles in lungs, D. Hypotension. So the correct answer is option number C, crackles in the lungs. Crackles in the lungs indicates fluid overload. Crackles is also known as rales. It indicates the presence of fluid in the air sacs or alveoli. These crackles, the sound is commonly heard with a stethoscope. Clear? Rationale. Crackles indicate fluid in the alveoli caused by pulmonary congestion, a sign of fluid overload in heart failure. Next question. A nurse is administering digoxin to a client. Which assessment is most important before giving the dose? A. Blood pressure, B. Heart rate, C. Respiratory rate, D. Temperature. So what does this digoxin do? Digoxin, it decreases the heart rate, right? So the question asks which assessment is most important before giving the digoxin. So before giving digoxin, we have to check heart rate, apical heart rate. Apical heart rate for full 1 minute. Okay, full 1 minute. So we have to hold the dose if the adult heart rate, if the adult heart rate is less than 60 per minute, and in children, if the heart rate is less than 70, and in infants, if the heart rate is less than 90 per minute, then we have to hold the dose of digoxin. Clear? Rationale. Digoxin can cause bradycardia. Therefore, the nurse must check the apical pulse and hold the dose if heart rate is less than 60 beats per minute in adults. Clear? Next question. A client is receiving IV potassium. Reports burning at the site. What should the nurse do first? A. Stop the infusion, B. dilute the solution, C. increase the flow rate, D. apply a warm compress. So there is a patient who is receiving IV potassium. Reports what? Burning at the site of IV. What should the nurse do first? So which will be the correct answer? The correct answer will be A. Stop the infusion. Burning at the IV site, it indicates phlebitis. So to prevent further tissue damage, we have to stop the infusion and we have to remove the cannula and insert a new one. Clear? Here the rationale is explained as Burning indicates possible phlebitis. The infusion should be stopped immediately to prevent tissue damage. Clear? Next question. A nurse teaches a client with diabetes about foot care. Which statement indicates understanding? A. I will shock my feet daily. B. I will walk barefoot indoors. C. I will check my feet every day. D. I will trim my toenails close to the skin. So, the question asks a diabetic patient about foot care. So the correct answer here will be option number C. I will check my feet daily. Why? Because inspection of the foot every day, it helps detect early signs of injury or infection and prevent complications such as ulcers. Next, a postpartum client reports severe perineal pain and pressure. A postpartum client reports severe perineal pain and pressure. The nurse suspects A. Infection, B. Hematoma, C. Laceration, D. Normal healing. So when the patient reports severe perineal pain and pressure, it indicates or the nurse suspects what? Hematoma, due to accumulation of blood in the tissues. Rationale: a perineal hematoma causes intense localized pain and pressure due to blood accumulation in the tissues. Next, a nurse is caring for a child with croup. Which nursing intervention is appropriate? A. Encouraging coughing. B. Providing cool mist therapy. C. Give cough suppressant. D. Perform chest physiotherapy. So, the croup. What is croup? Croup is also known as what? Laryngotracheobronchitis. Laryngotracheobronchitis. It is a respiratory illness that affects the larynx, trachea, bronchi, leading to inspiratory stridor and barking cough. In croup, we can see what? Barking cough and stridor. Stridor is an abnormal high-pitched breathing sound. In exam, you can see questions from the group. Mainly, they will ask like, barking cough is seen in which disease, or stridor is seen in which disease condition. This type of question we can see in the exam. Okay, so here the correct answer will be provide cool mist therapy. Rationale: cool mist therapy helps reduce airway inflammation and ease breathing in children with croup. This cool mist therapy is given because it reduces the inflammation in the airways and makes the breathing easy in children with croup. Okay. Next, which medication should the nurse question for a client with peptic ulcer disease? A. Omeprazole, B. Ibuprofen, C. sucralfate, D. ranitidine. And the correct answer is B. Ibuprofen. Ibuprofen should not be given in a patient with peptic ulcer disease. Ibuprofen belongs to NSAIDs, non-steroidal anti-inflammatory drugs. Okay, so why ibuprofen is not given? Because it irritates the gastric mucosa. Okay, rationale: NSAIDs like ibuprofen irritates the gastric mucosa and worsens the ulcer formation. So in peptic ulcer conditions, we should not give ibuprofen. Next, a client with schizophrenia states, "The government is watching me through the TV. What is the best response?" A. You know that is not true. B. Tell me more about your thoughts. C. I watch that same channel. D. That must be frightening for you. So, the best therapeutic response by the nurse here will be D. That must be frightening for you will be the most therapeutic response by the nurse, because it focuses, this statement focuses, or this response focuses on the emotions and not on the delusion, and it does not reinforce the delusion. Okay, rationale: acknowledging feeling helps build trust and support while avoiding reinforcement of delusional beliefs. So option number D will be the most therapeutic response. Next question. A nurse prepares to insert an indwelling urinary catheter. Which action maintains sterility? A. Keep sterile gloves above waist level. B. Place the tray on the client's bed. C. Use clean gloves for lubrication. D. Touch the catheter tip only once. So to prevent or infection or maintain sterility, which action is correct? Option number A, keep sterile gloves above waist level. So this will be the correct answer. To maintain sterility, and the best action of the nurse will be keep sterile gloves above the waist level. Placing the tray on the client's bed is not the appropriate answer. Use clean gloves for lubrication. We don't use clean gloves, we use sterile gloves for lubrication. Touch the catheter tip only once, and we should not touch the catheter tip. Next, rationale: maintaining sterile gloves above the waist level prevents contamination of the sterile field. So we have to maintain the gloves hand above the waist level. Next, a nurse is teaching about lithium therapy. Which statement shows the need for further teaching? A. I'll drink plenty of water. B. I can limit my salt intake. C. I'll get my blood levels checked. D. I'll take my medication with food. So the correct answer will be I can limit my salt intake. This statement indicates the need for further teaching. Because limiting the salt intake can lead to increased lithium levels in the blood. It will lead to increased lithium levels in the blood. Which will actually lead to increased lithium levels, okay, or lithium toxicity. So the nurse requires to educate the patient on the importance of maintaining a consistent and moderate sodium intake to the patients who are on the lithium therapy. Rationale: sodium restriction increases lithium reabsorption, risking toxicity. So the client should maintain consistent and moderate amount of salt intake while on lithium therapy. Next question. A nurse is caring for a client on warfarin. Which finding be reported immediately? A. Nosebleed. B. Mild headache. C. Fatigue. D. Nausea. So we all know that warfarin is an anticoagulant. So it makes the blood thin, which increases the risk for bleeding. So the correct answer will be option number A, nosebleed. Rationale: a nosebleed may indicate excessive anticoagulation and increased bleeding risks. Next, a nurse assists a client post-hip surgery to ambulate, which prevents dislocation. A. Keep legs crossed. B. Avoid bending more than 90 degrees. C. Rotate hips internally. D. Sit in a low chair. So to prevent dislocation, the precaution should be taken is avoid bending more than 90 degrees. Option number B is the correct answer. To prevent hip dislocation, should avoid bending more than 90 degrees. Should not keep the legs crossed or should not rotate the hip internally and should not sit in a low chair. Okay? And avoid bending more than 90 degrees. Rationale: flexion beyond 90 degrees can cause hip dislocation. The client should maintain hip precautions during movement. A client with COPD has a PaCO2 of 60 mmHg and a PaO2 of 55 mmHg. What action should the nurse take first? A. Increase oxygen flow rate. B. Encourage deep breathing. C. Notify the provider. D. Place the client in high Fowler's position. So the patient with COPD is having hypercapnia and hypoxia. So what action should the nurse take first? The correct answer is option number D. Place the client in high Fowler's position. High Fowler's position helps the lung expansion and improves oxygenation and ventilation. Clear? Rationale: positioning improves ventilation and oxygenation before other interventions are implemented. A nurse administers morphine IV. Which assessment is the priority? A. Heart rate. B. Respiratory rate. C. Urine output. D. pain level. So morphine belongs to which drug group? It belongs to opioid or narcotic analgesics, right? So before giving morphine, we have to check respiratory rate because it can lead to respiratory depression. So that's why we need to check respiratory rate prior morphine administration. Rationale: opioids depress respiration. Monitoring respiratory rate ensures early detection of respiratory depression. A client on insulin therapy develops diaphoresis and confusion. What should the nurse do first? A. Give orange juice. B. Check blood glucose level. C. Call the provider. D. Administer glucagon. So the patient is on insulin therapy and the patient is developing what? Diaphoresis means excessive sweating and confusion. So they are the sign of what? They are the sign symptoms of what? Hypoglycemia. So what should the nurse do first? The nurse should check blood glucose level. B will be the correct answer. The nurse need to check blood glucose level to rule out hypoglycemia. Rationale. Assessing glucose confirms hypoglycemia and guides for appropriate treatment. Next, which tasks can be delegated to a nursing assistant UAP? UAP stands for unlicensed assistant personnel. A. Assessing pain. B. Administering oral medications. C. Measuring intake and output. And D. Teaching deep breathing exercise. So, unlicensed assistant personnel can assist the patient in activities of daily living like monitoring intake and output, basic care like ambulating and all, feeding, dressing, under the guidance of registered nurse. So here the correct answer will be option number C, measuring intake and output. These UAP are not allowed to assess, administer any medication or to give any teaching to the patient. Clear? Rationale. UAPs can perform routine tasks like measuring intake and output but not assessment, medication administration or teaching. Next, a nurse is caring for a client with neutropenia. Which instruction is appropriate? A. Eat fresh fruits and vegetables. B. Avoid large crowds. C. Receive live injections or live vaccines. D. Shared utensils with family. So what is the question? A nurse is caring for a client with neutropenia. Neutropenia is a type of white blood cells. Neutrophil is a type of white blood cells, and neutropenia meaning low neutrophil level. Which instruction is appropriate? So white blood cells, it protects us from infection, right? Or it helps us to fight infection. So when we'll have low level of this WBC or neutropenia, then the patient is more vulnerable for infections. So the option number B will be the correct answer. Avoid large crowds to prevent infection. Rationale. Clients with neutropenia are immunocompromised. So avoiding large crowds is very important to reduce infection risks. Which finding indicates effectiveness of furosemide therapy? A. Weight gain. B. Decreased edema. C. Elevated BP. D. Crackles in lungs. So furosemide is what? Brand name, you get it, Lasix. It belongs to diuretic drug. Diuretic drugs, it increases the production of urine, right? So the correct answer is B, decrease edema. Rationale. Furosemide promotes diuresis, reducing fluid overload and edema. Next question. A client with pneumonia has thick secretions. What nursing intervention helps loosen them? A. Restrict fluids. B. Encourage deep breathing. C. Provide humidified oxygen. D. Increase activity. So a client with pneumonia has 3 secretions. The nursing intervention to loosen the secretion is, the correct answer is to provide humidified oxygen. Humidified oxygen, because it moistens the secretion and helps to expectorate. Clear? Rationale. Humidified oxygen moisten airways, making secretions easier to expectorate. Which action best prevents pressure injury in a bedbound client? A. Massage reddened areas. B. Reposition every 2 hours. C. Keep heels flat on the bed. D. Use plastic seats. So, in a bedridden patient or bedbound patient, to prevent pressure injury, the best action is, the correct answer will be option number B. Reposition every 2 hours. So how this bed sore occurs? So when the bedridden patient are lying on the same position for a long time, on that area there will be decreased blood circulation. So when there is decreased blood circulation, there will be what? Tissue damage, right? So to prevent that, we have to reposition the client every 2 hours. Repositioning improves the blood circulation and prevents pressure injury and keeps the skin healthy. Rationale. Regular repositioning relieves pressure and promotes circulation, preventing pressure injuries. So I hope everyone has understood or gained something from this class or from this session. For more videos, kindly like and subscribe our channel. Thank you.